Hello everyone, welcome back to Medico Days. In this video, I've compiled 200 questions of the Jan 2025 session Fmge. So quickly moving on to the first question, radiological image showing string of pearl sign, answer is PCOS, image of a needle, answer is Veress needle, Holman-Miller, juvenile nasopharyngeal angiofibroma, bluish discoloration of cervix, Chadwick sign, rapid and significant hair loss in a woman undergoing chemo, answer is anagen effluvium, 27-year-old woman with periods, acne and excessive hair growth. First line management is lifestyle modification. Common side effect of bleomycin, answer is lung fibrosis. Eighth question, patient presents with merciful anosmia, atrophic rhinitis, 40-year-old woman with chronic vomiting, elevated bicarb levels and increased pH causes metabolic alkalosis. Histopathological image showing follicular cells with pink eosinophilic cytoplasm, answer is medullary carcinoma. Fmge gene mutation is seen in Burkitt's. Pedigree chart showing disease transmission from mother to children. Inheritance is mitochondrial. Changes seen in irreversible cell injury. Clumping of chromatin. Timing at which triphenyl tetrazolium chloride can elicit changes post-MI. 3 hours. 60-year-old with lesion on medial canthus. Histopath showing nesting cells with peripheral palisading. Basal cell carcinoma. 50-year-old presents with mass that was operated. Diagnosis from microscopic examination. Answer is mucinous carcinoma breast. 45-year-old with headache, histopath showing world appearance with samoma bodies, answer is meningioma. Next question, 8-year-old child with obesity. What is present in the child? Microdeletion of paternal chromosome 15. Next question, von Willebrand factor binds to GP1B9. Microscopic image with lymphoid structure with an overlying epithelium, answer is tonsil. Next question, raised AFP is seen in hepatocellular carcinoma. Next question, image with large chondrocytes and perichondrium present, answer is elastic cartilage. Next question, palatine tonsil rests upon pharyngobasilar fascia. Skin over the 4th and 5th digits is supplied by, answer is ulnar nerve. Next question, in bulbar urethral rupture, urine is collected in superficial perineal pouch. Next question, image showing hair cells, corpuscles, answer is thymus. Treatment of Cryptococcus, fluconazole plus liposomal amphotericin B. Next question, a patient consumed fried rice and came with vomiting after 6 hours. Causative organism, Bacillus cereus. Causative agent for prosthetic valve endocarditis, answer is Staphylococcus epidermidis. Next question, patient presented with lesion on upper limb after rose thorn injury. Causative agent is Sporothrix schenki. Next question, culture media with green pigment. Organism is gram negative and oxidase positive. Answer is Pseudomonas. Next question, IgM anti-HPC is associated with acute infection. Next question is a radiological image showing port spine. Next is a radiological image with coffee bean sign. Answer is sigmoid volvulus. 35th question, newborn child with respiratory difficulty. Doctor evaluated and found a posterolateral defect. Image is also given. Answer is Bosch-Dallek hernia. Next question, a construction worker got injured from a hammer fallen on his head. Type of fracture is depressed. Radiological image showing teardrop sign seen in orbital for fracture. Next one, radiological image showing dural tail sign seen in meningioma. Next is radiological image shows temporal lobe abscess. Next one, a patient with dysphagia of motor liquids and solids. Radiological sign seen is smooth tapering or rat tail sign. Next one, chest x-ray showing pneumoperitoneum is seen in, answer hollow viscous perforation. Next one, smoker with radiological image, answer is lung abscess. Next one is a radiological image of prepatellar bursitis or housemaid's knee. Next one, a patient has neck mass with glue ear, management is radiation therapy. Moving on to next question, Renee's test negative on right side and left side Renee's positive. Diagnosis, right conductive hearing loss. Next is an image of a sign, the answer is target sign. Next one, CT image with an arrow showing the drainage area in case of maxillary sinusitis. Answer is osteomeatal complex. Next one, identify the type of tympanoplasty in the image is type 3. 49th question, a mother feeds a child and the child chokes due to apple seed. Location of obstruction, trachea. Next one, mother feeds a baby. Groundnut enters the bronchus. Management is Heimlich's maneuver. Next one, radiological image showing steeple sign. Diagnosis is croup. Next, find the image of type B tympanogram. The answer is the image. Next one, for multibacillary leprosy, incorrect treatment is rifampicin 450 mg monthly. 54th question, image of acrodermatitis enteropathica is given. It is due to deficiency of, answer is zinc. Next question, image of capillary hemangioma, management is observation. Next one, image of a patient with psoriasis. What sign is seen here? Answer is Auschwitz sign. Next one, a patient with painful genital ulcer and bilateral lymphadenopathy. Diagnosis is cancroid. Next one, treatment of acne vulgaris. Answer is isotretinoin. Which of the following is involved in milk ejection reflex? Answer, oxytocin. A patient is performing weightlifting. What is the change seen in sarcomia? Answer is eye band decreases. 61st question, what is seen in Cone syndrome? Answer is hypokalemia. Next one, right shift of oxygen dissociation curve is seen in acidosis. Balancing the body is done by vestibulospinal tract. A wave in JVP corresponds to atrial contraction. Treatment for bit spots, vitamin A. Gum bleeding seen in vitamin C deficiency. Deficient enzyme in child with ochronosis, homogeneous oxidase. Enzyme raised in prostate cancer, acid phosphatase. Next one, a 4-day-old child with 15 mg per deciliter bilirubin, diagnosis, physiological jaundice. Next one, 2-year-old child with Bolex, normal calcium and increased PTH, diagnosis, rickets. Diabetes mellitus cataract is due to what deposition? Answer is sorbitol. Next one, Graham Steele murmur is seen in pulmonary regurgitation. Next question, water hammer pulse is seen in? Answer, aortic regurgitation. Next one, unstable patient with BP less than 90/60, irregular pulse and absent P wave. Management is cardioversion. Next one, first degree AV block is seen in? Answer, prolonged PR. Next one, smoker with PFT findings of decreased FEV1. Answer is COPD. Question number 77. In a patient with mountain sickness, a drug was given. It acts on which part of the nephron? Answer is PCT. Next one, which of the following drug is not used in hypertension in pregnancy? Answer is lisinopril. 79th question. A patient on anti-epileptic therapy developed gingival hyperplasia. Most likely agent is phenytoin. Next one, drug preferred for treatment of meningitis. Answer is ceftriaxone plus vancomycin. Next one, which anti-TB drug requires normal functioning of CAG gene? Answer is isoniazid. Next one, drug preferred in cervical carcinoma. Answer is cisplatin. Next one, which of the following drugs can be used to reduce cardiovascular mortality? Answer is SGLT2 inhibitor. Next one, a patient consumed 5 tablets of paracetamol. Child was then given N-acetylcysteine. Mechanism of action of N-acetylcysteine is it replenishes the glutathione store. Next one is a question based on cisplatin versus carboplatin. Answer is cisplatin is more nephrotoxic. Question number 86. Drug of choice for malignant hypothermia. Answer is dantrolene. Next one, in osteoporosis, patient on zoledronate therapy, we ask the patient to maintain upright posture. This is to reduce the risk of esophagitis. Question number 88. CKD patient with diabetes, which DPP4 inhibitor is preferred? Answer is linagliptin. 89. After ART therapy in a TB patient condition worsened. Causes? Answer is immune reconstitution inflammatory syndrome. Next one, diabetic patient on metformin with HbA1c more than 7.5. Next step in management. Answer is increase the dose. Question number 91. Iodine 131 side effect is hypothyroidism. 92. Noradrenaline effect is BP increases and heart rate decreases. Question number 93. A patient on olanzapine therapy stopped taking the drug due to a side effect she had. The side effect is? Answer is weight gain. Question number 94. Treatment for delirium tremens. Answer is lorazepam. Question number 95. Patient on warfarin therapy. Recommended INR is? Answer is 2 to 3. Question number 96. Patient with asthma had symptoms consistent with PSVT. Drug preferred is? Answer is verapamil. Question number 97. Latanoprost side effect is? Pigmentation of iris. Question 98. Right scrotal swelling with right hydrocele and left testis normal with enlarged preaortic lymph nodes. Investigation needed is? Answer is excision of right testis and epididymis. Question 99. Cyanosis after 48 hours of bone fracture. Diagnosis is fat embolism. Question 100. Procedure not done for varicose vein treatment. Answer is sclerotherapy. Next one. Identify the swelling on dorsal aspect of wrist. Answer is ganglion cyst. Next one. A patient had head injury, is open eye to verbal response, localizing to pain and is confused. The GCS score is 12. Next one. Swelling on the neck. Identify the group of lymph node. Answer is level 2. Next one. Identify the instrument. Answer is Barron Barn ligator. Next, patient with respiratory distress and absent breath sounds on one side and trachea deviated to opposite side. Diagnosis is tension pneumothorax. Next, total body surface area of burns in a child. Answer is 30.5. Next is an image and the answer is vacuum assisted closure. Next one, identify the structure marked and the answer is right hepatic duct or artery. Next one, a married female died within 7 years of marriage in unnatural circumstances. Section related is 176 CRPC and 196 BNSS. Next one, a female died within 7 years of marriage under unnatural circumstances. Inquest is done by answer magistrate. Next one, fixation of postmortem lividity occurs in answer 8 to 12 hours. Death in police custody. Inquest is done by answer magistrate. Next one, a doctor received 2 summons, one from criminal court and the other from civil court. Correct statement is answer attend the criminal court. Next one, leading questions are allowed in. Answer is cross examination. Next one, cephalic index of 85 belongs to Answer mongoloids. Next one, a chronic alcoholic patient comes with tremors, insomnia, and anxiety following cessation of drinking. Diagnosis is answer is delirium tremens. Next one, true about dying declaration. Answer is oath is not required. Next one, a study was conducted in 2014 with a group of 5,000 to 6,000 people to study the occurrence of a disease till 2024. What type of study is this? Answer is prospective cohort. Next, population norm for Asha in urban area. Answer is 1,000 to 2,500. Killing mosquito larva with Paris green belongs to which level of prevention? Answer primary. Question number 121. A patient presented with a family history of type 2 diabetes mellitus. Screening should start from answer 30 years. Next one. Question number 122. Which of the following is included in the base of triangle of level of health services? Answer is subcenter and BHC. Next one. Image of a schoolgirl is a mascot for which disease? Answer leprosy. Question number 124. In a study population of 2,200 are deceased and out of 260, 160 had the disease. The specificity is 92.7. Next one, in a school 75 children go on a trip and 80% were vaccinated for a particular condition. Out of them 12 were affected with the disease. What is the secondary attack rate? Answer is 80%. Next one, colonoscopy was done as a screening tool in a patient. It is an example of answer secondary level of prevention. Next one, vaccine contraindicated in pregnancy. Answer varicella. Next, National Deworming Day is celebrated every year on. Answer is 10th February and 10th August. Next is identify the larva A with no siphon tube and the larva B with siphon tube from the image. Answer is Anopheles and Culex respectively. The nodal or ministry for disaster management. Answer is Ministry of Home Affairs. Next question. An epidemic occurred in a particular village due to cholera. There were 12 deaths reported among 60 cases. The case fatality rate is 20%. Next question. Management of HIV positive patient with dog bite for rabies. Answer is vaccine plus immunoglobulin plus wound management. Next question. In a study, mean value found was 82 kg and standard deviation of 1.5. Calculate the 95% confidence interval. Answer is 79 to 85. Next is the formula for sensitivity. Answer is true positive by true positive plus false negative into 100. Question 135. Fractional IPV dosage schedule in national immunization is 6th week, 14th week and the 9th month. Next one, Danida supported by which health program in India? Answer is blindness. Next one, a 24-year-old male diagnosed with psychiatric disorder has become aggressive with neighbors. He speaks rapidly and sleeps very less. He also shows hyperactive behavior after discontinuing his medicine. Diagnosis is bipolar disorder, manic episode. Next one, a doctor asks a patient about her age. She tells her age only after telling a long story about her. What is the most likely thought disorder shown by the patient? Answer is circumstantiality. Next one, affective flattening implies answer negative symptoms. Question number 140. A lady comes to hospital after fighting with her husband. She is unable to speak. All examination reports are normal. She is not concerned about her health status. Diagnosis is labelling interference. Next one. D-shaped pupil is seen in iridodialysis. Question 142. Cover and cover test is used for Latin squint or phoria. Next, significant difference in refractive error between both eyes. Answer anisometropia. Next is an image-based question and the answer is Marcus-Gunn-Joubing syndrome. Next, homonymous hemianopia with macular sparing is seen in defect in occipital cortex. Next is an image-based question and the answer is cystoid macular edema in Irwin-Gass syndrome. Next is the magnification of indirect ophthalmoscope. Answer is 3 to 5 times. Next question, home-based pregnancy test is based on answer beta-HCG. Question 149, earliest sign in pregnancy on transvaginal sonography. Answer is gestational sac. Question 150, which CVS changes are not seen in pregnancy? Answer diastolic murmur. Question 151 is an image-based one and the answer is open neural tube defect. Next question, fetal anemia is monitored by? Answer is MCA-PSV. Next question, identify the CTG pattern. Answer is early deceleration. Next question is image of Reckley's forceps. This forceps is not used in answer obstructed labor. Next question, baby head is delivered but shoulders are not delivered. After how much time will we call it shoulder dystocia? Answer 60 seconds. Next question, which surface of placenta is shown in the image? Answer is fetal surface. Next one, identify the procedure. Answer is intrauterine balloon tamponade. Question 158, a patient had forceps delivery, following which she had severe pain in the episiotomy site. On examination, there was swelling and bluish discoloration. Which of the following should not be done? Answer, remove the suture in the ward. Question 159, a woman had difficult labor and C-section. She complained of dribbling of urine on the 7th day of delivery. Diagnosis, vesicovaginal fistula. Question 160, 46XX karyotype and P57 and KAP2 negative. Answer is complete mole. Question 161, correct USG characteristic in ectopic pregnancy is? Answer empty uterus with adnexal max. Next question is an image-based one and the answer is pouch of Douglas. Next question is again an image-based question and the answer is genital TB. Next question, which hysterectomy has less chance of ureteric damage? Answer is vaginal. Next, after how much time of vasectomy can a patient not use alternative contraceptive? Answer is 3 months. Next question, OCP does not prevent which cancer? Answer is breast. Next question, drug of choice for endometrial hyperplasia is LNG IUS. Next, in cervical cancer, which radiotherapy is given? Answer is platinum-based radiotherapy. Question 169, which of the following is not reversed by atropine? Answer muscle weakness. Next question, last link in ACL is chain of survival. Answer is recovery. Next, neck vein dilated cord-like structure is palpated. Answer is external jugular vein. Next question, which drug is stopped before anesthesia? Answer is AC inhibit. Next question is an X-ray image and the answer is left endobronchial intubation. Question 174, a child with midarm circumference of 10.5 centimeter and eating food well. This is severe uncomplicated severe acute malnutrition. Next question, a child with increased upper segment by lower segment ratio. Diagnosis is achondroplasia. Next question, a 2-year-old child came with fever, cough and fast breathing of respiratory rate of 52 without chest in drawing. Answer is pneumonia. Next question, which parameter is affected in chronic malnutrition? Height for age. Next question, image with an arrow pointed to a sinus. Answer is maxillary sinus. Next question, a child came with melena with acute intermittent pain in right iliac fossa. On surgical exploration, an image is shown. Diagnosis is Meckel's diverticulum. Question 180, a 26-year-old female was brought to burns department and face and lower limbs were spared. Calculate the percentage of burns. Answer is 40 to 50%. Question 181, a patient with grade 4 hemorrhoids underwent surgery. Identify the instrument from the image used here. Answer is hemorrhoids band kit. Next question, from the image of an ulcer, identify the mark structure. Answer is edge. Question 183, identify the procedure. Answer is intravenous pyelogram. Question 184, during laparoscopic surgery, when inserting the trocar, which of the following is most prone to injury? Answer both A and B, that is superior and inferior epigastric arteries. Next question, which of the following is not related to progression of basal cell carcinoma? Answer duration. Question 186, a 5-month-old child comes with vomiting after feeding, failure to thrive, and on examination, an olive-shaped mass in the upper abdomen is felt. Diagnosis is pyloric stenosis. Next question, a 30-year-old female comes with a lump. Histopath image shows a leaf-like pattern. Diagnosis is Phyllots tumor. Next question, a 22-year-old female comes with severe urge to pass urine but unable to do so. On examination, blood on meatus is seen. Likely site to be injured is bulbar urethra. Question 190, a woman after 2 weeks of delivery comes with fever and complains of bloody discharge from nipple. Under examination, diffuse lump under areola is felt. Diagnosis is lactational mastitis. Question 191, spread of prostate cancer to lumbar vertebra is by venous route. Next question, varicose vein of grade C4A, treatment is? Answer endothermal ablation. Next one, a patient with breast cancer underwent cobalt-60 radiotherapy. It presents with respiratory distress. Radiological image showing haziness in the left lung is seen. And diagnosis is radiation pneumonitis. Next question, primary use of endoscopic ultrasound is used for staging of esophageal cancer. Question 195, most likely diagnosis of radiological image showing bat wing appearance. Answer is pulmonary edema. Next one, epiphysis in the lower fibula. Answer is pressure epiphysis. Question 197, to control hypoglycemia, which drug is given? Answer glucose oral or IV or glucagon IM or intranasal. Next, drug of choice for hypercalcemia. Answer is loop diuretic. Question 199, nitroglycerin route of administration in ICU patient. Answer is IV route. And the last question, botulinum mechanism of action. Answer is it decreases the release of acetylcholine from the nerves. So subscribe to my Telegram, YouTube and Instagram channel. I'll be coming up with more updated content. I'll be putting the link for my Telegram channel in the description where you can find the PDF of this video in my Telegram channel. Do share, subscribe and like my video. Till I come with a new video, stay tuned. Bye.